I'm Logan Crawford, and right now on Spotlight, we're speaking with Dr. Philip Caravella. He is pulling the curtain back on the American healthcare system with his insightful book. It is called How the Healthcare System Will Fail You. Wait no longer. He is offering readers a critical look at healthcare pitfalls and empowering them with knowledge to navigate a flawed system. We're delighted to have this very talented author join us here today on Spotlight. We thank our team at Atticus Publishing for helping us put him in the spotlight today. And we ask viewers like you to support writers like him by subscribing to our channel and, more importantly, buying this important book. The links are below this interview. Doctor, great to see you here today. Welcome to Spotlight.
Well, thank you so much, Logan, for having me here. And I'm glad that you are allowing me to talk about this book. This is a book that is so important. It must be essentially read by everyone who would ever see a physician, because the practice of medicine is complicated, and the delivery of healthcare is equally as complicated, and that's where the problems lie. However, the thing about this book is what it does is it asks the patient to take a hands-on, personal duty to do what is best, not only for themselves, but for significant others. And I refer to it as a way that the patient should be the captain of the ship. Mm-hmm. And why is that? Well, because at the end of the day, the captain of the ship makes all the final decisions. Now, the physician is in the role of the navigator. The physician is the expert, and he knows what should be done for the majority of patients. However, at the end, the patient must follow the advice whenever possible. And there are reasons why things go wrong. And a lot of that has to do with not a very good understanding of the complexities of the healthcare system and how it can be achieved in a successful way, and how they can have a good outcome. So there are such things as the patient, when they make an appointment, even making the appointment can be complicated to some extent. And then the next question is, who does the patient want to see? Well, it's always best to have a primary care physician. For example, let's say that a woman has abdominal pain. She does not have a primary care physician, and she starts out by going to a gynecologist, which is a common thing when they think of abdominal pain. Then after that didn't help, so she sees a surgeon, a general surgeon. Well, that wasn't it either. And then eventually maybe a gastroenterologist. Spends a lot of money, and quite often, she didn't follow the protocols that have to be followed by, let's say, her health insurance, and she should have health insurance whenever possible. So if she went to see her primary care physician to begin with, like a family doctor, then he probably could diagnose and manage the problem right from the get-go. And usually, like in my case, I rarely refer because I'm very familiar with almost all problems that people have in general. I do know when to refer, however. But the shortcut is, if the patient sees their family doctor, it's usually the most expedient thing to do, the least complicated. However, it's not over then. Then the patient will be given a variety of choices to make from the standpoint of different testing that may or may not be necessary. For example, in my case, let's say this woman had abdominal pain, I did an exam, and I could, just by the exam itself, I can pretty much rule out appendicitis. I don't find a need to do, a CAT scan, ultrasounds, and all kinds of other things. However, if I'm very certain, and I likely could be, I would send her immediately to a general surgeon to be taken care of. And I would call up the surgeon and give him my thoughts and so forth. So therefore, you have the connection there between the family doctor and the specialist. Well, as I said, that's the shortcut, the least expensive thing to do, but it does rely on a belief that the family doctor knows what they're doing and is competent. So that's a big part of it. Now, sometimes patients don't take the advice of the physician. They don't get a test done. They don't do this, they don't do that. And now they're gradually getting into hot water. The book thoroughly goes over all aspects of every detail you can think of, from making the appointment, showing up for the appointment, having the tests done, filling prescriptions, taking the medications. And when they see a doctor, no matter who it is, whether it's their own family doctor or if they're seeing a nurse practitioner or a PA, a physician assistant, which is sometimes the case because the biggest shortage in the United States is of family physicians. That's the number one shortage. So not everyone can see a family physician as often as they would like. Having said that, when they do see someone for an office visit, it's critical that they bring in their prescription, their bottles of medicine. And there's a lot of reasons for that. It's not just a list of the medications. Bring in the bottles. The doctor wants to look at the bottles to see if you're taking the medicines correctly and so forth and so on. So there's a lot of things like that that have to be done. Now, women are the primary people who utilize the healthcare system, and they, as I said, often will make appointments for their children, for their significant other, and so forth and so on. So they're the primary consumer, and this book addresses, like I said, all aspects that you can think. It's about 25 or 30 chapters long, and that sounds like a lot. How can there be that much? Well, that's the complexity of the healthcare system. But by reading this book, by following the advice that's in the book, the outcomes are going to be far, far better. The chances of a failure in the healthcare system is very unlikely if you take the advice that I share with patients in this book.
Yeah, it's all great advice, doctor. And the first step that you mentioned is very, very important, to have a great primary care physician. Like you said, there's a shortage. It's hard to get one. You live in a big city, good luck trying to get an appointment with a PCP or a family doctor. And then they also try to pawn you off on a physician assistant or nurse practitioner who has a fraction of the training of a medical doctor. So it's sometimes difficult to be the pilot of your own health, don't you think?
Well, that's true. There's some good news there. It's fairly required in most states that nurse practitioners and PAs have to have a physician in attendance to address a physician with questions and concerns that they're not familiar with. And also the family physician, the MD or DO, will review their records to some extent to be sure that the quality of care is there. However, some places don't even have a family doctor, and they're kind of running on the fringes of where they should be. And that doesn't bode well with the local medical boards of different states. So they always have to have at least one family doctor or that type of a person on board so that they're there to answer the questions and review. They might be, like, for example, I've been asked to go in and see a patient by a nurse practitioner to evaluate the patient myself. And my diagnosis and thing might be 100% different than what they're thinking. Again, I have the most, family docs have the most training, the most expertise, and we cover the gamut of medicine. Specialists are very good. Like, you have a hand surgeon. They might be an expert in hand surgery, but they don't know anything about the rest of the anatomy or the rest of the person, or the huge volume of material that covers the gamut of medicine. So again, we're the best ones for dealing with these things. And I'll tell you the truth, though, Logan, I have never worked a day in my life. I mean, I love the practice of medicine. There's no work involved. It's an honor and a privilege to take care of patients. And also, I have a special expertise in preventive medicine. In fact, there's another book. It's a sister book to the first book. The first book is How the Healthcare System Will Fail You. The second book I have right here, it's called Preventing You from Failing Yourself. Wait No Longer. And that word wait is WEIGHT. So that's another book that people should take a look at. If they look at both of these books and read them, they're going to be in a very, very good position to live longer, live better. And I'll be honest with you, people who follow the advice in the second book could easily live to well into their 80s or 90s. Yeah. And the sooner they get started on that type of progress, the better off they're going to be. But both books are critical. And I don't know if you have any other comments.
Yeah, what do you think is the most significant cause, or what are the most significant causes of preventable premature death in America?
Okay, that's a great question. I'm glad you asked that, Logan. Well, get this. The third most common cause of death in America is failure of the healthcare system. When I ask people about this, they'll mention different cancers or diabetes and you name it, but that's not the case. It's failure of the healthcare system. So that's where the first book comes into play. The thing is, the big problems in America are a lack of fitness and exercise. In fact, the second book gets into that. Believe it or not, like I work out approximately once or twice a day, 40 minutes in the morning, often 40 in the evening. Now, people say, what the heck? I mean, I don't have time for that. Well, look, if you make time for that, you're going to live into your 90s. And if you don't, you could be dead in your 40s or 50s.
Right.
The number one thing that people have to do is find a way to exercise every single day. And that could be by themselves or with a significant other. And by exercise, I mean brisk walking, biking, cycling, treadmill, and things like that. Exercise is king. Now, if you check, even with the Mayo Clinic, now I trained at the Cleveland Clinic, which is ranked just slightly below the Mayo Clinic, though the Cleveland Clinic is #1 in the world for heart surgery and heart disease. But in any case, my training there led me to get into preventive medicine. Part of that is because my father died at the age of 58 from a heart attack that was never diagnosed. He died in his sleep. My mother woke up and he was dead one day. And that should never have happened, especially being from Cleveland, where the Cleveland Clinic, is the #1 institution in the world for heart disease. And so forth. And then my best friend, Sam Teresi, died unexpectedly in Florida during an operation where they cut through his aorta and he bled to death. I mean, there's no excuse for that. That's negligence. So there's a lot of things that have to be done better and right. And part of that is selecting the right physicians. So, that's difficult. That's difficult to know, but doctors do have credentials, and it's important to look at maybe their past and how they feel about people as individuals. And the art of medicine is actually more important than the science. You have to be a scientist. You have to understand, but the art is critical.
Absolutely. Absolutely. So 1, control your weight. 2, exercise. 3, before you get sick, find a good family doctor, primary care physician. Those would be 3 takeaways from today's talk. Don't you think, Doctor?
100%. You got it all right, Logan.
Awesome. The name of the book is How the Healthcare System Will Fail You, Wait No Longer. It is written by Dr. Philip Caravella. It is a fascinating read. It's an important read. It's a read that'll help you get your own health on the right track and help you navigate this very complex system of healthcare that we have here in the United States, the best in the world, but you got to know how to navigate it. And this book is your guide. Doctor, thank you so much for joining us here today on Spotlight.
Thank you so much. It's been an honor and I appreciate it.
The honor is all mine, sir. And to the folks at home, I'm Logan Crawford, thanking you for your time this time. Until next time on Spotlight.